Assalamu alaikum wa rahmatullahi wa barakatuh. This is Dr. Tahanim Milabi, the Vice Dean for Clinical Affairs in College of Pharmacy at King Khalid University. I'll present Pharmacy Preceptor Orientation and highlight the important point when precepting KKU Pharmacy intern. Before we proceed with our orientation session, we would like to acknowledge the effort provided by Preceptor at all training sites who participated in training KKU Pharmacy interns, and also would like to welcome all new Preceptor. On behalf of the Dean, faculty members, and pharmacy interns, thank you for the time you took to share your professional experience in pharmacy practice with our pharmacy intern. As you may know, involving students in many aspects of pharmacy practice play a major role in the personal and professional development of future pharmacists in Saudi Arabia. We would like to start with stating the College of Pharmacy vision. It's to accomplish national and international recognition for excellence and innovation in pharmacy education, scientific research, and community service. College of Pharmacy mission: graduating pharmacists capable of playing an effective and efficient role within the healthcare professional team to serve the community through direct patient care, scientific research, and community engagement. Students you may encounter at your practice site are IPI students or API interns. Let's start with IPI student. IPI stands for Introductory Pharmacy Practice Experience. And IPI students are those who are in their 5th academic year, and their training timing is usually 2 days a month. The date of their training time will be specified in the list sent to you, and the goal is to expose the student to the various aspects of dispensing in a community and hospital pharmacy setting. At the end of each training day, students will ask you to sign their attendance sheet. No evaluation is needed for IPI students. You also may encounter ABI interns. ABI stands for Advanced Pharmacy Practice Experience, and ABI interns are those who completed all didactic courses in the college, and they will be at your practice site on daily basis to apply and advance the knowledge and skills developed in the pre-API curriculum. Here is a short list of Preceptor Responsibility, and more information is available in the manual, which will be discussed later. We encourage a brief orientation in the first day of training. Give the intern a tour in the pharmacy, introduce them to pharmacy staff, explain the site policy, and discuss expectation in the first day of training. Provide students with opportunity to advance their knowledge, skills, and experience in accelerated time frame through a structured, practice-based training program aligned with the course syllabus. Remember that pharmacy interns are not licensed pharmacists, and their activities must be supervised all the time. We also encourage continuous constructive feedback, as it will help students to improve their personal and professional skills. We also expect from the preceptor to report any training-related issue to the Experiential Education Office. API interns are those you're going to see on daily basis and eventually evaluate their performance at the end of each rotation. The presentation will highlight the major policy, but manual and all policy pertaining to pharmacy training can be easily found in the college website, pharmacy.kku.edu.sa. A link to the manual will be sent by email to you as well. The interns placement is done by the Experiential Education Office in College of Pharmacy, and multiple factors may affect placing a student in a specific training site versus another. When placing students in a training site, we take into our account student GPA, student preferences, and seat availability at each training site. We strongly discourage students from contacting training site directly to arrange placement, as it may negatively affect his or her peers assigned at the same training site and disrupt the flow of interns placement. In such cases, we would greatly appreciate directing them to the experiential education office if they reach you to arrange placement at your site. Once interns schedule finalized, a list of pharmacy interns will be sent to each training site via email 3 to 4 weeks before the start of each academic semester. Each academic semester consists of 3 rotations, except summer include 2 rotations only. And this is how the list of pharmacy interns look like. The name of the training site will be written on the top. The first column has the start and end date of each rotation. The number of the column depends on the type of rotations provided by the training site. It might be outpatient only, or it might be outpatient and inpatient, or outpatient, inpatient, and internal medicine. So it's basically depends on the type of rotations provided by each training site. Intern's name and university ID are listed as well. University ID can be used to email interns in case if you need to communicate with them. You can use university ID at kku.edu.sa. If there are any requirements mandated by your training site, we strongly encourage you to send an email to students using their university ID. The university ID provided in the list of pharmacy interns showed in the previous slide. Requirement could be something like immunizations or paperwork. Interns must sign time in and time out using the daily attendance sheet on daily basis. It's required to submit the sheet along with the evaluation form at the end of each rotation. Pharmacy interns are required to complete 200 hours for each rotation. In cases of absences of 3 days or less per rotations, the student has to make up the missed days. In cases of absences more than 3 days per rotations, preceptor must report to the experiential education office by email. A student have to make up for the missed hours in case if they were late. So our lateness policy says first time late, receive a warning from the preceptor. Second time late, they have to make up hours equivalent to half a day. Third time late, they have to make up hours equivalent to 1 day. Fourth time late, they have to make up hours equivalent to 2 days. Fifth time late, preceptors has to report to the experiential education office by email. Interns evaluation must be completed during week 5 of rotation using the intern evaluation form and submitted to the experiential education office. Any delay in submitting the interns evaluation, it may result in a delay of interns graduation. So please submit it on time. All forms, including the evaluation form, are available in the college website, and the link is provided here. At the end of each rotation, we require 2 documents to be submitted to the experiential education office: interns evaluation and daily attendance sheet. Those documents can be sent to the experiential education office via email using your official email, or it can be delivered by the interns in a stamped closed envelope, or it can be handed to the KKU Supervisor. And this is our preferred way. KKU Supervisor is a faculty member who will perform a regular visit to your training site. and facilitate the communications between the college and your training site. KKU supervisor might meet with the preceptor to discuss interns' progress, make sure that the training process goes smoothly, and if there is any training related issue, they can discuss it with the preceptors to have it solved. At the end of each academic semester, you will receive a link for pharmacy preceptor survey. It's very important to us and it will take 1 to 2 minutes to complete. The purpose of the survey is to gather data for continuous improvement. Contact information. If you have any question, concern, feedback, or training related problem, you may contact Experiential Education Office at eeo.pharmacy@kku.edu.sa. If you want to discuss any training related matter, you can contact me personally through email or phone number listed here. You also may contact pharmacists at Experiential Education Office at their emails or phone numbers that listed here as well. Thank you.